As spring break approaches, many of us are planning trips away and a boarding stay for our doggy buddies. But that can put them at risk for catching kennel cough. And here to tell us what that is and how to treat it is Dr. Jennifer Crow with Noah's Animal Hospital. Dr. Crow, thank you so much for coming in today.
Good morning.
So tell us a little bit about this. How do our puppies pick this up?
So it's a lot like the kid crud. Groups of dogs together, whether they're playing at a boarding kennel, being groomed, or even at doggy daycare, if one of them is coughing, it's a contagious bronchitis. So they cough it out and another dog breathes it in.
So when you get back from your trip and your dog is hacking, what are the signs? What do you look for?
So it is a dry hacking cough. Most owners will mistake it for their dog choking, but they're not choking because they're not in distress, but it's a real dry hacking cough, and it is comprised of actually a number of things. There's 7 different players that can be part of kennel cough, so it's usually not just one specific cause.
So there's bacteria that's involved. How does it affect the actual dog? What's going on?
So it infects the upper airway, so usually just the windpipe. Occasionally we'll see that it progresses to pneumonia, but most of the time they're going to build up some phlegm, and so they'll cough and they'll hack, and it sounds like they're going to vomit, but nothing comes up. In some cases it will cause a secondary irritation to the eyes or even the sinus cavity, and we'll see a snotty nose or even something like pink eye.
So you mentioned pneumonia. That is pretty serious. So this is something you really need to get your dog in for.
So some dogs, oftentimes it's very much like a kid with a cough, and if it's all viral, it may clear on its own within about a week. But other times they're coughing so much that they have difficulty being able to rest, and the owner will bring them in so that we can give them some medication for cough. And if we think that there is a bacterial involvement, we can use an antibiotic. But most of the time they're not struggling to breathe, they don't develop a high fever, and they keep eating and doing their normal activities.
So they're not necessarily in a lot of pain, just the uncomfortableness of coughing, which we all experience, is very uncomfortable.
Yes, that is true.
And so a little bit of medication, possibly, if it's lasting longer than 1 week.
Yep. And if they're having issues keeping you up at night because they're coughing or they can't sleep, those are times to let your veterinarian know. The good news is that there are vaccines. Bordetella, adenovirus, parainfluenza, the respiratory forms, there's vaccines for those. So we can easily protect our pets from picking up this cough.
Right. So a good idea before you head on your trip with all your to-do lists as you're packing and getting your appointment ready for wherever your pet is going to stay, get those vaccinations.
That's right.
Great. Well, thank you so much to Dr. Jennifer Crow from Noah's Animal Hospital for being with us today. Back to you.